With 2.7 million residents, Chicago is the most populous city in both the state of Illinois and the American Midwest. The city is an international hub for finance, commerce, industry, technology, telecommunications, and transportation, with Chicago O'Hare International Airport being the second busiest airport in the world. Even though Chicago is the third largest city after New York City and Los Angeles, it has a higher homicide rate and one of the highest stroke mortality rates in the country. A stroke occurs when the blood supply to part of your brain is interrupted or severely reduced, depriving brain tissue of oxygen and nutrients. Risk factors for stroke are divided into 5 different categories: genetics, race, gender, age, and drugs or alcohol. Older men and women are more likely to have a stroke. Risk factors include high cholesterol, diabetes, cardiovascular disease, high blood pressure, and atrial fibrillation. Females' risk for stroke increases if they have a history of preeclampsia and through the use of estrogenic birth control, while people who utilize illicit drugs such as cocaine and methamphetamines or drink excessively are also at risk. Homicide rates are increased due to sex, violence, and drugs or alcohol. Through assaults on women, child abuse, and love triangles, over 15% of homicides have occurred. 25% of the homicides in Chicago were because of liquor, gang-related narcotics, and territorial narcotics, while 60% of total homicides in Chicago came from violence, specifically domestic violence, armed robbery, retaliation, burglary, gangs, and theft. Our team of public health experts were brought here to see if Jackson's idea of preventing homicides in the communities to reduce stroke mortality rates is an effective solution. Through this presentation, our panel of experts will refute Jackson's idea and propose a better intervention, while also effectively showing that through variables like education, employment rates, health status, and income status, stroke mortality and homicide rates are statistically associated.